Today we are going to talk about the cycles approach. The cycles approach is a phonological intervention that is a great option for kids with moderate to severe phonological impairments. I'm Amy Graham. I'm a speech language pathologist in Colorado, and I specialize in speech sound disorders. I'm also the author of the Cycles decks. There are 6 decks from Bjorn's speech, and we're going to talk about these decks, but more specifically, we're going to talk about the cycles approach and how this specific approach can really be beneficial for kids who have so many sounds that they're missing or so many phonological errors that you just don't know where to begin. This can be a great option for kids just like that. All right, so let's talk about it. Now, in the cycles approach, it's different from other approaches like maybe minimal pairs or complexity in that we prioritize specific error patterns that we're going to target, the ones that have the biggest impact on intelligibility. For example, we're not going to target everything that the child has an error. We're going to analyze their speech, so make sure you're doing a really thorough assessment. You've analyzed for all the phonological error patterns that that child presents with, and then we're going to look at their evaluation and determine which error patterns are going to have the biggest impact on improving that child's intelligibility, because that is the overall goal for the cycles approach, to improve intelligibility. So once you've done your assessment, what we're looking for, at least initially, are 5 types of error patterns that we're going to target. And let's talk about each one of those. The first one is syllableness, and that is represented by the syllableness deck from Bjorn's speech in this green deck here. So if a child is monosyllabic, we're going to target that. Think about it. If a child is saying or only marking one syllable for all of their words, that is going to have a huge impact on their intelligibility. So we're not talking about weak syllable deletion where they might just drop one syllable, like pajamas might be jammas, or banana might be nana. That's not the error we're talking about, because I understand what a child says when they say they want a nana. I don't understand them if they say ba for banana or ma for pajamas. They're not marking syllables. So we need to address that as one of our primary error patterns. And the way that we do that in this deck for Bjorn's speech is we're using this concept of cognitive reframing in a way. So if we show them the picture of a snowman, each of these cards in this deck has a little dot that represents each syllable. Now, we're not focusing, when we're working on these words, we're not focusing on producing every sound perfectly. This is about marking syllables. So snowman. Now, if the child looks at this and still says ma, right, for snowman, then we're going to get the 2 pictures that go hand in hand with snowman, and we're going to teach them individually. Snow, and there's the little first syllable. Man, there's the second syllable. Snowman. And having 2 pictures to represent both syllables for these compound words will help teach that child syllableness, how we mark syllables. So that's the first error pattern that we're going to target if that's what the child is exhibiting, syllableness. Now, the next error pattern that we consider a primary error pattern within the cycles approach is initial or final consonant deletion. So this is if a child is omitting consistently either sounds in initial position or sounds in final position, or both. I've had kids who do that, initial and final word position. We're going to address that, because imagine what an impact that has on intelligibility if you're omitting entire parts of words. So for example, if a child is omitting the initial word position, right, but they can produce the d sound, we're going to practice words like day, dive, dog, right, to just help them start to say the sound at the beginning of the word. Or if they're omitting sounds at the end of a word, you might choose simple monosyllabic words like ape, up, what's this one, mop. In order to teach them, we have to produce this sound at the end of a word. So that's another primary error pattern. If a child is omitting initial consonants or final consonants, we're going to address that. Now, I'll talk about how we're going to address that in just a minute. I just want to talk about the specific error patterns that we're going to prioritize. And the next one is S clusters. So if you have a child who may be stopping, like maybe they're saying dope for soap, or they're omitting S's in clusters, like maybe they're saying top for stop, we're going to address both of those by addressing S clusters first. We may target words like spoon or spa. Again, very simple monosyllabic words, words that make the sounds that we're targeting easy to say. The next error pattern that we would target as a primary error pattern within the cycles approach would be if a child is fronting or backing. Remember, if they're doing both, it's neither one. Likely we have to focus on an error pattern that is consistent. So they have to either be fronting consistently or backing consistently. So if you have a fronter and they're saying all their K and G's as T's and D's, you're going to try to elicit that K sound or that G sound, and you're going to use words like cow, cup, and call, and teach those words, and that's how we're going to address fronting. If they're backing, you're gonna look in the same deck and we're gonna grab words, maybe we're gonna work on the D sound, right? If a child is backing, they're producing the T's and D's as back sounds instead. So we might try to elicit the D sound in words like doll or door or dip. Now, the last error pattern that is considered primary in the cycles approach is gliding. If a child is gliding, if they're saying maybe W for L or R, we're going to address that as well too. And you might be asking yourself, wait, hold on, what if the child is 3 or 4? Do I still address some of these sounds like L and R even though they're later developing sounds? Yes, we still address gliding even if a child is younger. And here's why. I had the privilege of seeing or listening to Dr. Hodson, who developed this approach, speak, and she said that if you hold off and think, this child is 3 or 4, let's work on L and R later down the road, those kids tend to remain in speech up to a year or 2 longer than those younger kids for whom you just decide to incorporate teaching them about L and R early on. Now, if that's a little confusing and you need kind of a visual representation of what all of those particular error patterns are, what sounds we should be targeting for each of those error patterns, I have a really helpful guide. It is linked down below and it includes so many helpful resources. So click that link. You can find this data guide to help you plan out your cycle for your kids. Determine, okay, if I'm going to work on syllableness, what kind of words do I address? If I'm going to work on initial consonant deletion, what sounds should I consider? And this can actually help you plan your entire cycle, keep data, take progress notes. It's really helpful, so I encourage you to click that link down below. Now, once you've determined, okay, what error patterns am I going to target with this child? You've looked at all of these 5 error patterns and you've determined, yes, this is what I'm going to target. Now, you're going to choose between 2 and 6 sounds to target each error pattern one at a time in a very cyclical way. So let's talk about S clusters as an example. If that's one of those 5 error patterns that you're going to target, we have several S clusters that you can address S clusters with. So we can work on final PS, final TS, that's a great option, and those are all in the Cycles Bjorm deck. And we can address initial SP, ST, SM, SN, those very easy, simple to elicit S clusters. We're going to target those and choose up to 6 targets for each error pattern. Now, if you're only targeting fronting, for example, we really only have K and G to target fronting with. So we're only going to pick 2 sounds for that error pattern. So once you've decided which of those 5 error patterns you're targeting, you've chosen 2 to 6 sounds per pattern. Now, for each sound, you only choose a handful of words. So let's say you're going to work on S clusters. You only need 3 to 5 words to target SN with. We've got, I love this one, snot. We've got snap, sneeze, snow, and you're only going to target those words for 60 minutes of therapy. That's it. So once you've targeted those SN words for 60 minutes, now that can be 2 30-minute sessions. It doesn't have to be all in 1 hour, but 1 hour a week is recommended for this specific approach to be effective. So once you have your 3 to 5 words you're targeting for 60 minutes of therapy, we're not going to just stick with those words until they're producing that particular S cluster in spontaneous speech. We're just going to cycle to the next group of words that you have chosen based upon your cycle that you've selected for that particular child. So maybe that's SM clusters the next week. So you might choose words like smell or small and just target those for another 60 minutes of therapy until you've cycled through all of these error patterns. That is one entire cycle. So you can see, if you're targeting a lot of error patterns and a lot of sounds within each error pattern, to get through one cycle, it could be 14, 15, 16 weeks, depending on how many sounds the child has in error. One thing I love about the cycles approach is that there's a very systematic way that we also do the therapy during that 30-minute session or 60-minute session, however you decide to break it up per week. It's called the therapy construct. Now, if you want more information about what you're actually supposed to do in that particular therapy session, check out my 2-hour course. I have real therapy videos that will show you exactly how to do a therapy session for the cycles approach. I hope you learned a little bit more about the cycles approach, maybe clearing up some things that were unclear about it. But if you want more information about it, please click the link below. I have so many resources available for you, including my 2-hour course. My course will explain everything in much more detail than I was able to go into this video, but it also gives you real life therapy videos explaining exactly how to do this particular approach, what a therapy session looks like, and even elicitation strategies as well too. So be sure to check that out.